And we will just wrap up this topic of elderly care with Dr. von Blumenthal, one of our GPs in the room.
Thank you. Britain spends about 8.7% of GDP on the health service. That's the lowest of the G7 nations. I think that that says something about what we feel National Health Service is worth and what we'd like to contribute. Does any of the parties have any thoughts on whether that is an appropriate amount, given that France, Germany, etc., spend well over 10% on their health service? Shouldn't Britain simply say, all right, let's spend more on the NHS and bring up the proportion of the payment for the NHS in our GDP?
Rupert Reid for the Green Party, briefly.
Yes, so I've said very clearly we are committing to spending 12 billion more on the NHS, and I've said where that would come from in terms of taxing the very richest in our society. But I think we also need to talk about why the costs are going up so much. That's privatisation partly that we're going to come to, and how we're going to move to a situation where the costs aren't going up like that forever. So there it's really important to talk about the causes of ill health. And that's where the Green Party, we really have a USP in terms of the causes of mental ill health, rising inequality in our country. We've got policies to reverse that. In terms of the causes of rising levels of heart disease, it's got a lot to do with obesity and stress. We've got policies to address that in terms of good diet, for example. In terms of the causes of respiratory illness, air pollution, we've got policies to address how to bring air pollution down, much more holistically, much more holistic than the other parties' view. So we have to look at the causes of ill health, not just at the consequences. And the Green Party has a joined-up set of policies that will address those causes. That's the only way I think that in the long term we can start to bring these expenses down and come to a more sustainable level of expense for the NHS.